So I also read a very interesting statistic that only 1 in 8 Americans are metabolically healthy.
That is wild and crazy and unfortunately true here in the United States. So the study was done by the National Health and Nutrition. They looked at almost 8,800 subjects, and they looked at certain markers of blood sugar, triglycerides, HDL levels, waist circumference, and also blood pressure. And yes, unfortunately, only 12% were found to be healthy, and these were patients that were not on medications as well.
Welcome to the Pure Wellness Podcast, where we talk about what it takes to live a holistic lifestyle by making conscious, healthier choices. Our hope is that these discussions will inspire you to strengthen your daily practice to improve overall physical, mental, emotional, and social well-being. Pure Wellness Podcast provides information solely for educational purposes and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. I'm your host, Johanna Altman, founder of One Body Medicine, avid health enthusiast, and mother of 3. Join me and industry professionals as we explore human potential in the pursuit of pure wellness. Hi, everyone. Thank you so much for joining me today. I have a very special guest, Jennifer Kwon, and I'm very excited to be talking about the subject of insulin resistance and metabolic health today with you. If you can, for those people that might not know who you are, just give us a little bit of a background.
Sure. I am a certified health coach and functional nutritionist with about almost 20 years of experience in the pharmaceutical industry, nutraceuticals, and also just medical wellness. Through my extensive training and clinical background, I've been able to train and educate and support healthcare providers in topics such as hormone replacement therapy, personalized nutrition, and also utilizing science-backed supplement protocols. Really, one of my biggest passions is to empower individuals through wellness education.
Well, I need all of those things, hormones and nutrition and wellness. So thank you for being here. I'm really excited to talk about metabolic health because personally, I know I briefly mentioned this to you. It's something that I right now am going through, and I'm sure a lot of people out there are experiencing some type of, let's say, pre-diabetes or diabetes. And the number one comment I get when I tell people I'm pre-diabetic is, how? Why? And these are still questions I have because for me, growing up, I felt that I typically had a healthy diet. I work out. My BMI is normal. So all of these general markers or things that I'm being told to look at, I feel like I'm doing a pretty good job of. And yet, how could my insulin resistance, or let's go to my lab work, how can my A1C be 5.9? And we'll talk about later how that was pushed to 6.4. I haven't told you this story. I know. So can you tell us a little bit more about what metabolic health is?
So metabolic health really is just an indication of how well our body is using energy or food and using it as energy, right? And then also being able to maintain certain types of health markers like healthy blood sugar control, cholesterol, right? And also having healthy blood pressure. So those are all indicators of having good metabolic health. But when we have metabolic dysfunction, it just means that we have probably 3 out of the 5 or 4 categories that show dysfunction, right? So we're having blood sugar dysregulation, like maybe prediabetes.
I'm heading in that direction.
Different cholesterol markers, and then high blood pressure.
Okay. So I also read a very interesting statistic that only 1 in 8 people, in 8 Americans, are metabolically healthy. So that means 7 out of 8 are metabolically not healthy or have metabolic dysfunction. Is that crazy?
That is wild and crazy, and unfortunately true here in the United States. So the study was done, or there were several, but the one that I'm going to refer to was done by the National Health and Nutrition. They looked at almost 8,800 subjects, and they looked at certain markers of blood sugar. They looked at triglycerides, HDL levels, waist circumference, and also blood pressure. And yes, unfortunately, only 12% were found to be healthy. And these were patients that were not on medications as well, right?
So they're using those markers to determine if you're metabolically unhealthy without actually getting the confirmation on a lab result. Is that what you're saying?
No, they were looking at labs.
Okay.
But through looking at those labs, they determined, wow, these people the majority of them are not within those healthy ranges.
Do they say
and
how
conventional ranges?
Oh, okay. So I know why you're mentioning conventional range, because there is a difference between a conventional and or reference range of normal, high, or abnormal, right, on your lab. But there's also what's called optimal, which is a much more narrow range. So this study was was a little bit more forgiving with the ranges. So there could have been more unhealthy.
There could have been more considered unhealthy. Correct.
Wow. So did they mention in the study what the age range was?
They used a variety of different age ranges within the study. But yeah, the most impactful conclusion really was that almost 88% of Americans are considered unhealthy.
That's crazy. That's crazy. I mean, for me too, I am going through this, as I had mentioned, and I am trying to find solutions and ways to improve my metabolic health. So I want to go back and talk about A1C and what that is and why my doctor typically wants to run my A1C when I'm getting lab work.
So A1C really is looking back historically for the last maybe 2 to 4 months on how your body is dealing with sugar. Okay, so that's one marker. There are other markers that are going to be more conclusive to how well your body is working with insulin and glucose, right? So A1C is one marker. The other things that typically are not run, but they should be looked at, is really fasting insulin and comparing that to fasting glucose. So there's a mathematical equation that's called HOMA-IR that will look at that. So when you look at both of those and it sits at either 1 or below, that's considered optimal, right? 1.9 and above is considered, not healthy. And then anything above that is, it's alarming, meaning that your blood sugar control is not optimized. Also, something that isn't really run as well is an OGTT. That's an oral glucose tolerance test where you're in a fasted state and then you take a bolus of glucose, and then they measure how quickly or how efficiently your insulin is clearing that sugar from your blood, right? After 2 hours. So I would say to really see what your metabolic health or your insulin resistance is to really take those 4 markers and really look at that.
Now, where could I get this glucose test and or the insulin fasting test? Could somebody just go to their primary care provider and request that?
Yes.
Okay.
Yep. But most don't run it. They just look at, again, A1C as a marker, and then also fasting glucose.
Yes, I've never done the fasting insulin. I did a long time ago when I was diagnosed with hypoglycemia as an athlete, take the glucose test, a 2-hour test, and it confirmed that that's what I had. But since that must have been 25 years ago.
Yeah.
So time to take that test again.
Yes.
Okay. And can we talk about, you mentioned reference range and optimal range. Can you talk about what the ranges are for insulin sensitivity, insulin resistance, and what optimal looks like? What numbers?
So if we're talking about the levels for A1C, most providers are going to say, oh, if you're 5.6 or below, you're considered normal, you're healthy. That's totally fine. But then the cutoff for being pre-diabetic is 5.7. So why would you wait until you went from 5.6 to 5.7 to suddenly start doing intervention, right?
Because we're not proactive. we usually wait until we get the notification or the marker that says, okay, it's
now you're in the danger zone.
Now it's red. Yes.
Right.
No, I agree.
So really what we should be looking at and monitoring is when our A1C is starting to creep up, right? So let's say it started at 5.4. Now it's going 5.5. Now it's at 5.6. That's all considered normal range, but it's creeping upwards. Oh my goodness, let's start doing something now.
So we need to collect the data points and we need to look and be our own advocate, which I say so much here on this show is that there's a movement for people taking charge of their health. So this is an example of being an advocate and saying, okay, what did my labs look like last year? Let's do a comparison because I'm getting my physical every year.
Right.
And is it trending? Are these markers trending in the right way or are they not trending
Correct.
in the right way?
Correct.
Okay. Yeah, I noticed that with mine too. Okay, so I know when we had initially spoken, you had talked about a few ways that somebody like myself, for example, could have better metabolic health. And one of those was through working out. And we hear so many times doctors and health advocates say, you know what, you have to work out. But is it just any type of workout? Are we talking cardio? Are we talking weights? Can you give me the tie and the correlation between insulin resistance and building muscle and the type of workout that we need to do so that we can improve metabolic health?
Okay, so that's a wide and deep answer.
Let's go. Let's get it.
So ultimately, if someone is sedentary, not moving at all, just moving alone is going to help with the utilization of any sort of glucose in the body. Okay, so just any sort of movement. That being said, having as much muscle as possible on your body is going to be able to use and pull that glucose out of the blood and be able to put it into the muscles or to the muscle cells for energy to use as energy, right? So if you think about it as similar to, let's say, having an Olympic-sized pool and fill it with water, right? That would be having a ton of muscle, and you're able to use and house that water, right? And use it as energy versus having a tiny little baby pool, that you have maybe in your backyard, and then you're having a bolus of all this water come in. Where is it going to go? It doesn't have any room except for that little pool, right? And then the rest of it is going to spill out. And then it's going to get stored as fat and cause dysfunction in the body.
That makes sense. So when I'm going to the gym, I really want to focus on resistance workout, me specifically, because my BMI is normal. And so I want to try to pack on the workouts that are going to help me build muscle.
Build muscle, maintain muscle, and so on. yes, doing cardiovascular workouts, even something as like a brisk walk, all the way up to, HIIT type training, that's going to help utilize maybe the glucose initially, but long term over time, even at rest, when you have more muscle, your body's going to be able to utilize any of those excess glucose that's in our blood, our sugar, and be able to push that into our cells, into the mitochondria, so we can use it as energy. So it doesn't get stored then as fat.
Okay, so we have to do pretty much, we just have to move around regardless.
Correct.
We have to do both. How many times would you say is optimal? I hear working out 3 times a week, get your body moving 30 minutes at a time. It doesn't seem enough. Is that enough?
I would say that is the bare minimum, is to move at least 30 minutes a day. A nice brisk walk. A brisk walk meaning you can kind of walk fast, but maybe talk to your girlfriends as you're walking along, right? But really, strength training is where it's at. Even if you did 3 times a week, a full body workout where you're lifting enough heavy weights to at least maintain your muscle mass, if not also increase it. And unfortunately, as we age, that muscle synthesis decreases for a couple of different reasons, right? Number one, as we age, we're not eating as much protein. And then on top of that, as we age, certain things like hydrochloric acid production in our stomach decreases. So any foods, especially proteins, can't be as well broken down in our body, so we can't utilize it as easily and use it as building blocks for our body.
I see. So you know what? You touched on a point that I wanted to dive deeper into, which is protein consumption and how that is reduced as we age. So isn't there, I remember hearing or reading something where there's a formulation of if you weigh a certain amount, you're supposed to have like half the amount in protein grams. Is that correct? There's some type of formula.
Yes. It's people get it all convoluted and, 0.7 per kilogram. But an easy way to look at it, especially if someone is trying to, let's say, either lose weight or maintain their muscle mass, I would have to say for ones that don't have your body composition, so you don't know exactly how much muscle mass you have, an easy calculation is how much do you weigh? Do you want to stay at that weight? So in other words, if you're a 150-pound woman and you want to weigh 120 pounds, then you can have 120 grams of protein. But if you're a 150-pound woman and you want to stay at 150 pounds, then a good marker or a good estimate would then have 150 grams of protein a day. That's kind of like a cheat way, really simple. You don't have to do any sort of calculations in your brain.
That I can do. But I'm telling you right now, based on that calculation or formula, I'm not eating enough protein to maintain.
Sometimes it can be hard,
my muscle
especially
mass
without supplementing it,
So let's talk about diet. And then I'd like to get into supplementation because I think that's going to be important. So there's so much like conflicting information on the type of diet that, an insulin resistant person should be on. And obviously I'm sure there's propaganda tied around to some of that stuff. But, based on your experience and when you work with patients, what does give me an example of a typical day of eating optimally so that I can, maintain my sugar levels. Because one of the misconceptions, and I don't know if it's a complete misconception, is that I should stay away from fruit unless they're on the lower end of the glycemic index. Like watermelon, not good for me. It's too high in sugar. So is that true?
Yes and no.
Okay. Tell me about it.
So really, it kind of goes back again to your insulin sensitivity response, meaning how well does your body use insulin, right? Which is that hormone that's going to help push sugar from your blood, from your blood into the cells for energy. Okay. So if you have a high dysfunctioning mechanism, right? So if you have high insulin resistance, then having higher kind of sugars in fruits is you're going to have a less inability to use that well, right? But if you have, let's say, moderate or not severe insulin resistance, then you can have watermelon or let's say pineapple or bananas, especially if you eat something with high fiber first.
Oh, are we talking about food sequencing?
Sort of. Yes.
Okay.
Yes.
I want to get into that too. We have to get into that too, because I think it's part of being more aware of how we can manage this insulin resistance. Okay, so going back to that answer and diving deeper, I understand depending on the level of insulin resistance, that would, determine whether or not we can have these higher fruits that are on the higher, have higher glycemic indexes. So having said this, for like just a general rule of thumb, would you say that it's a better idea to start, especially since we do have we're talking to people that have some type of insulin resistance, to just stay on the lower end of the glycemic index for a period of time?
Yes.
And then as the body starts to become more metabolically healthier, kind of introduce those higher glycemic index foods in later on.
Correct.
Okay.
Absolutely.
Okay. So what period of time? Because right now I'm only eating green apples and blueberries, and I would like to have some watermelon. It's summertime. So what is a good recommendation, like 4 to 8 weeks? Or again, I know it's going to depend.
It really depends. So it depends on your body composition. So the higher fat that you have, and more importantly, the higher visceral fat, the fat that you can't see, right? The ones that is layering our organs, which is more dangerous.
Yeah.
When you have higher levels of visceral fat, you want to make sure that you're working on that. So how much time? I don't know. It's very personalized. So it might take you a short period of time through some dietary changes, and lifestyle modifications, and suddenly your visceral fat drops. Whereas maybe for me, it may not be as easy, and I may have to lifelong manage my sugar intake. So it really depends on the person.
So one of the things I forgot to mention, I think is appropriate, is that I actually have a glucose monitor. I have a Dexcom G7. I love it. And I decided I didn't want to be diabetic, and my insurance doesn't cover it because I'm not diabetic. How sad is that? They're waiting for me to be diabetic to help me. So I decided to just pay for the glucose monitoring. And I have to tell you, that knowledge and having that data of what foods that I eat might spike my sugar, which ones I can tolerate a little bit more, really helps.
Right.
So I highly recommend that for anybody that is trying to prevent full-blown diabetes or might just be curious.
Correct.
So that's something that I use.
It's a great tool to use because you want to know the different types of foods that you're eating and how is it impacting your blood sugar, right?
Correct.
Sometimes we do want spikes in our glucose, okay? We need it for energy and so on. Mm-hmm. Again, more importantly is not so much the spike that is important, but also how well is it clearing? Because if it's spiking and then staying elevated, that's not good. That's a sign of insulin resistance. But if it spikes, but then clears out very quickly, that means you have really good metabolic health.
Okay, good. So the charts are looking better.
Good.
So that's good. So I highly recommend that for people curious who might have been frustrated not knowing particularly for themselves what foods trigger more resistance versus others that don't. So that works for me. Going back to diet, and something very interesting for me is food sequencing. So this is something that is new to me. It's newer. It's been about a year since I've heard people talking about a way or an order in which we should eat the food that's on our plate to help with insulin sensitivity and or resistance?
It's more for that glucose spike, right? Yes. So the more fiber that's in our foods or on our plate, it's going to help lower that impact of that spike. So you want to eat your fibrous vegetables first, and then your protein, and then your starchy carbohydrates or fruit, as an example, right?
Yeah, it's actually working. It works when I can get myself to think, okay, I'm having to train myself how to eat differently.
Right.
Because I usually will go to my main. I'll go to my protein. But yes, that has helped. The food sequencing and eating in that order has also helped me with my insulin resistance, I've noticed.
Yeah. Good.
Yeah. So that's amazing. One of the things I also wanted to touch base on, and I've gone through personally, is, and you and I briefly touched upon this, is how do can medication affect insulin sensitivity?
Of course. So there's a wide variety, but again, that's something that you would have to talk to your doctor and see the impact. Some medications can increase insulin resistance, and then there are other medications that actually that you need to be careful with, that your blood sugar doesn't drop too low. So I'm not a medical provider or in that sense. So, but you should talk to your physician with any sort of medications that you're on and how that's going to impact your blood sugar.
Well, I wanted to mention that because last August I had a full CBC panel done, and my A1C was 5.9, which was shocking. I was working so hard to lower this down, and it stayed the same from 6 months prior. And my cholesterol, through lifestyle dietary changes, was within the normal range. And my cardiologist said, you know what, Johanna, if you want, because I'm an overachiever, we can lower those cholesterol numbers. And I said, you know what, let's do it. And he put me on 20 milligrams of pravastatin. And 4 months later, if you could believe this, I did not do anything different other than take this statin for 4 months. My A1C, so back in December of last year, for the follow-up, was 6.4.
Yeah.
And I could not believe it because I was doing everything else the same. And after doing more research and speaking to my medical director at the clinic, he said, did you know that statins have a side effect of possibly creating insulin resistance?
Yes.
And I had no idea.
Yeah.
And my cardiologist knew that I was working so hard as well to, lower my A1C, to have better insulin sensitivity. So I was very shocked that he recommended the statin, knowing that my cholesterol levels were already in the normal range.
Right.
I shouldn't be able to tell him to give me a statin, but he did. And I made the decision. I called my cardiologist and said, listen, this is what happened to me. I'm not taking the statin anymore. I've done the research. I'm willing to try something different because at this point, with my A1C being 6.4, if I go to an endocrinologist, she's just going to put me on a second medication, a metformin or something. And now, if I look at it, I would be on 2 different big pharma medications versus not having any before I came to you.
Right. Right.
Is that crazy?
That is, yeah. Well,
and that's how it happens.
That's conventional medicine for you. It's just disease management for one particular thing. And then you go to another specialist and they want to manage another portion, and they're not looking at the body as a whole.
No. And it was starting to throw things out of sync. And our bodies are so innately intelligent and, can heal. So I removed all of that. And good news is my A1C is back down to normal.
That's good. That's really good. Another component, unfortunately for us Asians, though, is something to be aware of is typically Asians are not overweight, right? That's the typical stereotype, okay? And to think that, kind of going back to what you said earlier, is that your A1C was higher, you had insulin resistance, or more kind of like in that pre-diabetic range. The reason why that happens with Asians is a few different reasons. One, we have a particular gene variant that either we don't produce enough of those insulin sensitivity cells within our pancreas, right? Or those cells that are in our liver don't work as well.
I see.
So we can't, again, utilize that glucose as efficiently. Okay.
I see.
The other component to that is Asians in general also have a little bit more difficulty in maintaining muscle mass and gaining muscle mass. Again, so if we can't make our pool really big, that's going to impact our glucose.
That makes sense. One way though that some people I think are starting to now look at, well, as it's becoming more mainstream, hormone replacement therapy.
Yes.
Is looking towards hormones to possibly be able to help aid in muscle retention, muscle gain. So that's maybe something for people who are having difficulty gaining muscle to look into, right? For both men and women.
For both men and women, yes, because as women get closer to perimenopause and menopause, the drop in estrogen, as an example, really is detrimental because it increases, again, that insulin resistance, the inability to be able to use those sugars very well, right? And so we end up gaining that mid-belly fat, right? So that is a real phenomenon. And then also for both men and women, when our testosterone drops, we can't, again, maintain or build muscle as effectively, right? And then going back to talking to, as women get closer to that perimenopause and menopause state and our estrogen is dropping, that is really going to impact how well we are able to utilize that sugar. So we become more insulin resistant as we are becoming more deficient in our estrogen. Also, progesterone is also impactful in our bodies as well because it's affecting our cortisol, our stress, our ability to handle stress. And when we have high stress and our body can't handle that, that's also going to lead to accumulation of body fat. And then for both men and women, because women do make testosterone, right? When we don't have enough testosterone in our bodies, then we can't produce enough muscle mass or maintain that muscle mass. And again, if we don't have that big enough pool, right? We want to have that Olympic size pool, not the baby size pool.
Yeah. So there's a lot of stuff that we have to be
factors.
Mindful of,
Yes.
especially as we're aging. So I think hormones definitely something to look into just for health optimization, to feel good, building muscle, and hoping to help metabolic health, and insulin sensitivity.
Correct.
As we age. So I was looking into that because I feel like hormones are just, are understudied and not as well understood in medicine. There's
Correct.
Not enough information, education. So that definitely is something I'd be interested in. One other thing I wanted to ask, do you find, because I used to intermittent fast for years, do you find that intermittent fasting helps insulin resistance? Or I'm hearing a little bit more controversy going back and forth, whether or not it is effective or not?
So yes, and then no.
Okay.
So I too did a lot of intermittent fasting long before intermittent fasting was a thing. Okay. So starting in high school, I skipped breakfast and I just didn't eat it, mainly because I just wasn't hungry, which was fine. And I did that on and off through up until, let's say, maybe 4 or 5 years ago. I was able to keep and pretty much maintain my a healthy body weight, body composition, and so on. But again, as we get older and we're losing those hormones and the inability to maintain muscle mass, too much intermittent fasting or too much fasting in general, especially for women, is much more detrimental because we can't maintain that muscle mass. And it's much easier then for our body to sort of use our muscle as a source of energy, so to speak. And when we're doing intermittent fasting, right? Because it's trying to pull from our body's resources, right?
That makes sense. Actually, usually when I do reading on intermittent fasting, you hear more about the benefits in terms of dieting and losing weight or keeping optimal health. But we're not talking about body composition, or that if you were to do it for a prolonged period of time, that your body would actually go into the muscle.
Correct.
Which we don't want.
We don't want that.
Yeah, that's
absolutely.
Very interesting.
Absolutely.
So one last question.
Sure.
For someone who is watching this and is experiencing insulin resistance, what are some simple steps that you would tell them to do so that they could get started on a healthier metabolic journey?
Good question. The simplest way just to start really is to eliminate any of those processed foods, because those processed foods are going to be high in seed oils. They're going to be high in simple carbohydrates, right? Processed carbohydrates, and high in those added sugars. So if you start eating more natural types of foods, kind of shopping on the outside of the grocery store versus inside those aisles, you're going to automatically be able to bump yourself up metabolically speaking much better, right? You'll be in a much healthier state. That also being said, if you wanted to fine tune that, really research is showing and has shown that a lower carbohydrate diet is much more effective, not only for fat loss, but maintaining that body composition, being able to hold on to that muscle. Because when you're on a lower carbohydrate diet, you are prioritizing protein, meaning you're increasing that amount of protein to make up for that for those calories that you're not having carbohydrates, right? So really that would be the first thing. Also, again, if you're not moving very much, just go out and walk, 15 to 30 minutes, 5 times a week. Just get your body moving, and then do some resistance training, because that's really, really important.
Okay. Well, those things I can continue doing. And for those who have not started their journey into better metabolic health, I'm sure these are things that they could do. So, Jen, thank you so much for being
welcome.
here.
Thank you for having me.
Of course, I really enjoyed this conversation.
We could go long and wide with this. This is a forever topic.
I know, but I think we covered a lot, and I feel I've learned so much. And for those people who want to maybe look you up and find you, where can they do that?
So they can either email me at itsnotaboutthecookie@gmail.com.
But it is about the cookie.
It's not about the cookie. Yes, to a certain degree it is, but not really. So you can just go ahead and email me. I do take on a select amount of private clients per year. But emailing me is the best way.
Amazing. Okay. I'm sure people will be reaching out for you to help them. And thank you again for being here.
You're welcome.
This podcast is sponsored and brought to you by One Body Medicine. You can learn more by visiting onebodymedicine.com. That's the number 1, bodymedicine.com. You can also follow the show on social media under the handle Pure Wellness Pod. Thank you for listening, and we'll see you next time.